What are the differences between injectable polio vaccine and oral polio vaccine? So both of these vaccines are administered to prevent poliovirus infection. Injectable polio vaccine was discovered by Jonas Salk in 1952 and hence it is also called as Salk's vaccine, whereas oral polio vaccine was discovered by Albert Sabin in 1955, hence it can also be called as Sabin's vaccine. And in injectable polio vaccine, killed strains are used, hence it is also called as killed polio vaccine, whereas in oral polio vaccine, live but attenuated strains are used, hence it can be also called as live attenuated oral polio vaccine. So coming to formulations, so injectable polio vaccines contains all the three serotypes 1, 2, 3. But in oral polio vaccine, it may be available in as trivalent, bivalent or monovalent. Most commonly, bivalent oral polio vaccine is used, which is containing serotype 1 and 3. Coming to National Immunization Schedule. So, in National Immunization Schedule, this injectable polio vaccine, it is administered at 6th week and 14th week of the age along with the bivalent oral polio vaccine. Whereas oral polio vaccine, so bivalent vaccine of oral polio virus, it is given total 5 doses, 2 drops per dose. So 0 dose has to be given at birth and first, second, third dose should be given at 6th week, 10th week and 14th week, and finally booster dose should be given at 16 to 24 months. And coming to safety, so injectable polio vaccine is relatively safer than that of the oral polio vaccine. Since killed strains of virus is used here, it is safer. Whereas in oral polio vaccine, we are using live but attenuated strains, right? So these live strains, these are safer, but except in immunocompromised individuals or pregnant women or old age. Since they are having suppressed immunity, these live strains can rarely cause infection. And coming to efficacy, so injectable polio vaccine, it is comparatively less effective than that of the live or oral polio vaccine. So only the effectiveness can be completely achieved after full course of the vaccination, since killed strains are used here, which is injected through intradermal or intramuscular route. It directly reaches the blood and it doesn't multiply. Whereas in oral polio vaccine, where live attenuated strains are given orally, which reaches the gut and multiplies in the gut, which keep on multiplying in the gut. So effectiveness should be achieved within 1 to 2 doses itself. Whereas in killed polio vaccine, it requires complete course of vaccination to achieve the effectiveness. And coming to economy, injectable polio vaccine is expensive when compared to that of the oral polio vaccine. And duration of protection, so injectable polio vaccine protects for a shorter duration and it requires booster doses since killed strains are used, whereas oral polio vaccine, we are using the live attenuated strains, right? So it provides the protection for a longer period of time. And coming to immunity, so injectable polio vaccine only provides humoral immunity. It doesn't provide herd immunity as well as local immunity. But oral polio vaccine, it provides humoral immunity, herd immunity as well as local immunity. So when injectable polio vaccine is administered through intradermal or intramuscular route, it directly enters into the blood and provides humoral immunity, right? But oral polio vaccine, which is given through oral route, it reaches the gut first and it stimulates the mucosal IgA antibody production in the intestinal mucosa, and after that it enters into the blood, provides humoral immunity. And also this live strain passes through the feces and it spreads the herd immunity in the community. And coming to storage conditions, so injectable polio vaccine, it is relatively more stable. It doesn't require any stringent storage conditions, whereas oral polio vaccine, it is Less stable, it requires storage condition of minus 20 degrees Celsius, as well as it should be stabilized in magnesium chloride and pH should be maintained below 7. And coming to vaccine-associated paralytic poliomyelitis and vaccine-derived paralytic poliomyelitis. So, it is not at all associated with injectable polio vaccine, but very rarely it can be associated with oral polio vaccine. Hence, the live strains are used here. Very rarely it may be associated with the vaccine-associated paralytic poliomyelitis or vaccine-derived paralytic poliomyelitis, where because of the vaccine itself the individual can acquire the infection. Thank you.